The first time I heard that Black women were 3 times more likely to die because of maternal health issues was scary. I never thought that there was that issue before. And now I was in that situation. It made me feel like, what if something is wrong with me? And if I tell my physician or I tell the doctor that's seeing me or the nurse that's seeing me that they're gonna help me and they won't help me, what am I gonna do?
So as a Black woman, it is truly terrifying that despite having my medical degree, that implicit biases, racism can affect me during my interactions with medical providers.
I didn't feel heard. I didn't feel like I was respected. I just really felt like she looked at me as I'm just a young Black girl in here pregnant. And it's like, they judge that whenever you're in there by yourself. But it's like, I actually had my fiance with me. Sometimes it doesn't matter.
Unfortunately, implicit biases don't just affect thoughts, but they affect behaviors. And patients are aware of those behaviors and those thoughts when they're interacting with providers. And those type of interactions can discourage patients from seeking care.
I try to give everybody the benefit of the doubt. She didn't realize how it was coming off to me and how I was very upset leaving my doctor's appointments every time I went. It was to the point I would call my mom crying, like, I have to get out of here, but then it wasn't no other practices for me to go to.
Unfortunately, there are not enough African American providers or providers from underrepresented backgrounds in medicine. African American physicians comprise almost 5% of the U.S. workforce, but they comprise 13% of the general population.
I believe women should have access to doulas because it gives them an opportunity in cases where they don't understand something, that they can ask those questions.
In the short term, we need better strategies to provide comprehensive care to our mothers. So other initiatives such as doulas have been effective strategies to assist patients in advocating for themselves, as well as providing them with the skills to interact with the health system.
So we've already started having the conversations in reference to postpartum Medicaid. Medicaid needs to extend longer than the 90 days that it extends now. It needs to extend at least to a year. I don't even know if that's long enough, but for now, a year, because we have Black and brown babies that aren't even living beyond 1 year. And those numbers are even higher than maternal health deaths, so that's a problem.
I'm trying to get the news out there that we need to be more aware of what's going on with us as our bodies and also what's going on with our kids.
Learning how to be mindful and controlling my thoughts. I think that's important for me if I do want to become a mom one day, because I also want to raise mentally healthy kids.
We have had a Black to white infant mortality disparity ratio of about 2.7 to 1, so that babies born to Black mothers are 2.7 times more likely compared to babies born to white mothers to die before their first birthday.
I wonder if the doctors would have treated me differently if I had not been a Black woman in that hospital. I also wonder if they would have treated me different if I had not been a fat Black woman in that hospital.
When we take a step back and look at a higher level about what causes premature birth or any health outcomes, probably about 80% of those factors are outside of the walls of the hospital. And it's really those upstream factors, social factors, community level factors that contribute to maternal health, that contribute to infant health.
I think it's really important that healthcare systems are blunt about it. They need to speak up. They need to say, listen, these biases that you have, racism, making patients feel uncomfortable, it's not welcome here. So they need to start there. But also, I think that patients need to have access to advocates. But there also needs to be something in that facility letting patients know that if you don't feel comfortable, if you feel like your questions weren't answered, then this is who you need to talk to. Let us know.
I feel like the major solution is knowledge. That's it. Knowledge is key. Like, if no one knows what's going on, if they don't have the knowledge, then how are they supposed to know to take care of themselves, or how are they supposed to know how to take care of their child? Different things that could happen. It's all about knowledge, and people have to be willing to want to learn too.
Just be mindful of your health. Just be conscious of what you're eating, what you put into your body, exercise. Start reaching out to get medical care, whether it's primary care or just seeing a gynecologist.
It's the historical factors that have really shaped our community in an adverse way. Those factors that have really had downstream effects on whole populations and whole neighborhoods. But we really have to think bigger We really have to speak louder, and we have to listen to other voices as well to make those changes.
Your health matters now, and it's time to solve the maternal health crisis.